Niagara Health's Hepatitis C Care Clinic is part of the Addiction Services program, and each year the department recognizes World Hepatitis Day to raise awareness of the virus and the global effort to eliminate it. Joining me in the studio with more on this is Blodgett. Ryan, hepatitis C is preventable and curable. Can you provide a bit of an overview of what hepatitis C is?
Sure, and thanks for having me.
Of course.
So hepatitis C is a virus. It attacks the liver. It can be contracted through things like risky sexual practices, sharing needles, and some contraband related to substance use. It can also be contracted through things like unsafe spa equipment, through things like blood transfusions. So it's not just the sort of street level population that many people think it infects, but it also can infect baby boomers and other folks who wouldn't even think that they're exposed to it. One of the reasons why we put so much effort into outreach is that many people who have Hep C don't know they have it. And unfortunately, you can live with Hep C for years, if not decades, before you realize you have it, before you get to some of those end stage liver disease, cirrhosis, liver cancer. So the reason why we spread such awareness about hepatitis C is to get people tested, to find out if they have it, so that we can eliminate it before all of those negative health events happen.
And so what happens when hepatitis C is left untreated?
So when hepatitis C is left untreated, unfortunately, it is a very insidious process. Many people who have it are asymptomatic. Even the symptoms you experience, you may just think they're other symptoms. So what often happens is you don't realize you have it until you have some of those larger issues, like I mentioned, like cirrhosis, liver disease, and so on, which again is why we really promote getting tested. And if you think you've ever been exposed.
What's the best way to be tested? Is it blood work?
Exactly, yeah. So today, the first step of getting tested is as simple as the prick of a finger. If that comes back showing that you've been exposed to the virus, then you get further blood work. And once it's been confirmed that you have hepatitis C, it's as simple as a 12-week prescription of medication that's basically side effect free, that will almost guarantee that you will have hepatitis C eliminated from your system.
Wow, so it is very much worth getting tested.
Absolutely.
And so what are some of the services that your team offers at Niagara Health when it comes to hepatitis C?
So again, because of the nature of the virus, we do both in-house work, but we also do a lot of outreach. So we do get referrals from community, from Niagara Health, that we then follow up with and support our patients. But again, because most people don't realize they have it, we do a lot of work in the community, just going to places where folks tend to be more likely to be exposed to Hep C and offer them to get tested. So most of our work is done in community.
Do you find that there's still a lot of education that needs to be done?
Yes, and the great thing about the work we do is that Hep C is completely curable, and in theory, we can eliminate this. So it's sort of an interesting project to be a part of, but really it's about getting the word out. Because Hep C, again, is that insidious behind-the-scenes virus, it's not front of mind for many people, which is why we need to get out there and do that work to get people to get tested.
Well, I guess this kind of ties in nicely because World Hepatitis Day is Monday, July 28th, and Niagara Health has an event planned in St. Catharines. So why don't you tell me a bit about that?
Yes, I'd love to. So Friday, July 25th, we're holding our annual World Hepatitis Day event in Montebello Park, St. Catharines. For those folks who have been there before, they know it's a very lively event. We want to create an environment to get people out there. We have lots of music, we have food, but we also invite about 20 or 30 of our closest community partners. These are social service agencies, these are people from the Niagara region, from public health, a lot of the same services that folks who get their Hep C treated through us also use. So it's an opportunity for folks to come out to Montebello Park, learn about hepatitis C, get tested in a private area, and then also connect to some of the other social service agencies that our region offers.
Now, I can understand that there may be a bit of stigma associated with that. So what is the message that you have for people if they're wondering, maybe I do have it, or they're scared to get tested?
I appreciate you asking that because there is a lot of stigma around it. And as I mentioned before, anyone can have Hep C. It's not just the folks who are using IV drug use or those types of things. So it's really about breaking the stigma by coming out and getting tested. And coming out, again, it's a private area. You go behind with one of our nurses or someone from our outreach team. You get tested, you find out quietly if you've been exposed, and then confidentially you'll go and through the treatment process and get it completely eliminated from your system.
Now, is this something that would be tested by your family doctor at all?
So your family doctor would make a referral to our program. So if anyone thinks they could have been exposed to it, they can go through their family doctor, but they can simply just call our clinic and we'll either meet them in the community or they can come to one of our hospital sites and we can do all the testing for them.
And so what would be the best way for people to find out more information about this?
So to find out information about our event, just check our Niagara Health social media channels. If you're looking for information about our hepatitis C program, you can go to our website through Niagara Health.
Awesome. Well, thank you so much for joining us in the studio today.
Thank you so much for having me.